Hello dears, let us continue with shoulder region. We have seen the muscles connecting lateral border of scapula to humerus. Now we will see the muscles connecting the body of scapula and the acromion process to the humerus. The ventral surface of the body, that is subscapular fossa, is connected to the lesser tubercle by subscapularis muscle and it is supplied by upper subscapular nerve and it is a medial rotator of the humerus. Now, the supraspinous fossa gives origin to a muscle called supraspinatus. It is inserted to the greater tubercle at the upper part. And from the infraspinous fossa arises which muscle? This is supraspinatus, this will be infraspinatus. It also gets inserted to the greater tubercle on its lateral surface. So these two muscles will be supplied by suprascapular nerves and vessels. They will be seen in the supra and infraspinous fossae. The suprascapular nerve, do you remember it arises from the brachial plexus at the Ebb's point, that is from the upper trunk. Okay, so in Ebb's palsy, these muscles will be paralyzed. Now, let us see the next muscle which connects the spine and acromion process of the scapula to humerus. That is called deltoid muscle because it has a delta shape. This muscle arises from three regions. These are the posterior fibers. It arises from the lower border of the spine of scapula to the deltoid tuberosity of the humerus. You can see they are straight fibers like strap muscle. And the anterior fibers, which will be mirror image of this, will arise from the anterior border of the clavicle, from the lateral 1/3 of anterior border of clavicle that we have seen as a boundary of deltopectoral groove. It will also get inserted to the deltoid tubercle. The middle fibers, what will happen? They arise from the acromion process and they are also inserted to the deltoid tuberosity, and you can see that these fibers, middle fibers, are multipennate in nature. So what is the advantage of a muscle being multipennate? Number of muscle fibers will be more and the muscle will be stronger. So it's a very strong muscle and also a very bulky muscle. Okay. Now let us see the relations of the deltoid muscle. Deltoid muscle covers the shoulder joint and the anterior fibers of it will cover the coracoid process, and also if you draw the other muscles arise from the lateral border of the scapula, you can see some part of these are also covered by deltoid muscle. Now we can see the quadrangular space is almost completely covered by the deltoid muscle. So what is the importance? The axillary nerve and posterior circumflex humeral vessels will be beneath it. Since the deltoid is a very bulky muscle, we can use it for intramuscular injections. And you know, since the lower part has posterior circumflex artery beneath it, it will be more vascular. So, injection to lower half will be advantageous because the drug will be absorbed faster. But the disadvantage is that it contains the axillary nerve. So, here will be the axillary nerve and the posterior circumflex humeral artery beneath the deltoid muscle. The axillary nerve supplies the deltoid muscle. Okay, so if you want to give injection to the deltoid, you should give it to the lower half, but should be careful not to injure the axillary nerve. If axillary nerve is injured, the muscle will also get paralyzed. So you see, the axillary nerve is about 5 to 6 centimeter below the acromion process. So if you place your three fingers, if you palpate the acromion, that is the tip of the shoulder, and then place your three fingers beneath it, you can safely give injection to the lower part of the deltoid without injuring axillary nerve, because 3 finger breadth means only 3.75 centimeters. The axillary nerve is 5 to 6 centimeter below the acromion process. So that is about the clinical importance of deltoid muscle. Now let us see the action of these muscles. We have seen the action of teres minor and major. The and the teres minor muscle is extensor, adductor, and medial rotator. And we have seen that the teres minor can produce adduction, extension, and lateral rotation. But as the muscle is more towards the fulcrum, what happens whenever the muscle becomes more towards the fulcrum of movement, its action will be reduced. So the adduction and extension action of the teres minor muscle will be less compared to the teres major muscle. It is a very weak adductor and extensor, but the rotation will be there. So the weakest movement, that is rotation movement, will persist when the muscle, the insertion of the muscle is more towards the fulcrum. So you can see the infraspinatus is attached to the greater tubercle still higher up. So it is more towards the fulcrum. So it is only, can produce only lateral rotation. So it produces lateral rotation. Here it also produces lateral rotation, but there is a weak adduction and extension. Now let us see the action of supraspinatus muscle. You see the supraspinatus muscle is attached to the greater tubercle on its upper aspect. What will happen when this muscle contracts? It can pull the greater tubercle medially and thus rotate the humerus like this. You can move the humerus like this in an arc because it is the greater tubercle will be pulled medially. So that movement is abduction. But it is since it is a very small muscle and is close to the fulcrum, only a minimum abduction can be done by the supraspinatus muscle. So let us see it contracting like this. So when it contracts, it can abduct the humerus, but only up to about 15-degree abduction is possible. After that, the abduction is taken over by the deltoid muscle. So when the humerus is not abducted, it is in the perpendicular position, the deltoid cannot act on it because its axis, long axis is also like this, longitudinal. So when it contracts, it can only elevate the humerus. But when the angle increases, that is after the action of supraspinatus muscle, if the muscle contracts, it can elevate, it can abduct the humerus. So after 15-degree, the abduction will be taken over by the deltoid muscle. That is middle fibers of the deltoid. The posterior fibers can produce adduction and extension, and anterior fibers can produce adduction and flexion. Okay, the middle fibers can produce abduction. So when it contracts, the humerus moves like this. So up to 90-degree it can move. Then what happens? Once again its axis become parallel to the bone, and further contraction can only bring the bones together. So it cannot further abduct the arm. So overhead abduction of arm is done by rotation of scapula by upper and lower fibers of trapezius and serratus anterior muscle. So although we say that first 15-degree is done by supraspinatus, then 15 to 90-degree by deltoid, and after 90-degree by trapezius and serratus anterior, actually it doesn't happen so. The scapula will not remain static up to the 90-degree abduction. What actually happens is, for every 15-degree abduction, the 10 degrees will be in the shoulder region, at the shoulder joint, whereas 5-degree of abduction will be by rotation of scapula laterally. Okay, this is known as scapulohumeral rhythm. So we have seen some actions of this muscle. All these will help in stabilizing the shoulder joint, and that action we will see in the next video.